This is part 2, so the embryo transfer practice track. If you haven't done the embryo transfer technique track, do that first, at least twice. This track is designed for you to use to practice with so that you can go in and out of that relaxation through the abdomen, whatever you are doing. This means that when you're actually having your transfer done, it doesn't matter whether you're focusing and relaxing, whether you're closing your eyes, whether you're talking to the nurse, whatever you're doing, you're going to be able to work on those muscles and relax everything down. So what we're going to do is just get yourself into a comfortable position. And if you want to, you can even do this in the kind of position you'll be in when you have transfer. And a good way to do this is to lie on the floor with your legs up on the sofa so that you have a similar position that you will do when you're in stirrups. So, if you want to do this with your eyes closed, you can. More impactful and more effective if you can. Right now, in this moment, just to practice, you are going to bring your attention to the outer edges of your body. And you're going to just offer some softness and relaxation through the fingers, through the wrists. Just let everything go a minute. And then start to tune into the image, the concept, the idea of the link from the brain all the way down to the uterus. Think about that idea of the golden network that branches off of this core element all across the uterus, down through the cervix and the vaginal wall, across the lower back. And every breath that you take in, you're just sending the warmth, the nutrients, the oxygen, the calm. And you're just starting to ease a little deeper into that focus as you play around with the imagery and the sensation that you'll be able to feel at the moment. There's no particular way that you must feel or no right way to do this. Some people just feel generally focused and relaxed. Others feel warmth. Sometimes people can really sense the muscles starting to slow down and calm. Send that peace with the breath all the way down into the lower part of the body. And then I'll count down from 5 to 1. And when I get to 1, every breath out from then, you're going to ease into off. So you'll start to feel the waves of calm, soft relaxation as you relax down the pelvic floor muscles, the abdominal muscles that you can sense and react with that are all around the lower belly. And knowing that everything else will be internal and subtle and gentle. In 5, 4, 3, 2, 1. Off. Every breath in, inviting that calm. Every breath out, all the muscles are easing into still, soft relaxation. Sensation is drifting away from the body. You are focused and calm. And you're letting everything go nice and still and peaceful. You may even imagine the idea of the inside of the uterus just being very still and calm and inviting. A warm and nurturing space where you are preparing to invite your embryo or embryos into the space to settle and implant. Breathing in the calm, breathing out off. And the more you just let the pelvic floor relax, the abdominal muscles relax, know that these are the muscles that are deep through the vagina. These are not anything to do with your bladder. We are working on that system that's going up through the cervix, into the uterus and all the surrounding muscles. Just doing as much as you feel comfortable doing. And so now, with this relaxation in place, with this focus, allow your eyes to open. Have a little look around the room, just being aware. And now start to take the breath in for the calm. And really be aware of the sensations that are around your abdomen, your uterus, your pelvis, your pelvic floor. And start to think internally the word off. And as you do, start to let the out breath relax everything down. Know that unconsciously, your brain is already working to soften those smooth muscles. And you can let go of any other muscles that you are aware of in that area. You can soften everything down. Go as dead weight as you can as you think off, off, and off. All the work that you've done with the other track will mean that your body internally is already responding to this. And you are just getting used to being able to let everything relax down. Just by intending to and allowing yourself to. And you can practice this anytime, any place. You can just think to yourself, off. And you can bring your attention to the area and let everything go. Relax everything down. And the more you do this, the more you'll be able to actually feel the greater levels of that softening and that calming. And it is different for all women. So whatever your experience, it will be right for you. And even if you did nothing at all, but just attempt to relax the vaginal walls and the abdominal muscles that you can connect with around the speculum during the procedure, it will make a big difference. So everything that you're doing now is on top of that. Everything is adding to your optimization, you giving this the best chance. And it makes sense for you to be putting in all the things that resonate with you, all the things that make sense, and knowing that all of those things can absolutely be enough. So one more time, just breathing in the calm, breathing out off. Feel those waves coming through. And then you can take your time, you can continue to practice this, you can just sit in the quiet for a minute, or you can begin to stretch and move position and ease everything back into your normal day. And as soon as you start to move around, all the normal sensation and movement will resume and everything will go back to normal. So you can use this track to practice with. You can use it during embryo transfer with headphones if you want to, or you can use the technique track. And I would like to wish you the absolute best success and all the best wishes in the world for your embryo transfer.